Ever wondered how heart failure is classified? Well, it's a complex process that involves assessing various aspects of the heart's function. Today, we're going to delve into this fascinating topic. Firstly, the New York Heart Association, also known as the NYHA, has a functional classification system that categorizes heart failure based on the severity of symptoms and their impact on daily activities. It's broken down into 4 classes. Class 1, or mild, is where there's no limitation of physical activity. Ordinary physical activity doesn't cause undue fatigue, palpitation, or shortness of breath. Next is Class 2, which ranges from mild to moderate. Here, there's a slight limitation of physical activity. Individuals are comfortable at rest, but ordinary physical activity can result in fatigue, palpitation, or shortness of breath. Then we have Class 3, which ranges from moderate to severe. This class shows a marked limitation of physical activity. Individuals are comfortable at rest, but less than ordinary activity can cause fatigue, palpitation, or shortness of breath. Lastly, Class 4, or severe, is where individuals are unable to carry on any physical activity without discomfort. Symptoms of heart failure are present even at rest, and any physical activity increases discomfort. Now let's move on to the American College of Cardiology and American Heart Association, or ACC-HA staging system. This system focuses on the progression of heart failure and is divided into 4 stages. Stage A includes individuals at high risk for developing heart failure but without structural heart disease or symptoms. Stage B is when structural heart disease is present, but there are no symptoms of heart failure. Stage C is when structural heart disease is present and there are past or current symptoms of heart failure. Finally, Stage D involves advanced structural heart disease and symptoms of heart failure are present despite optimal medical therapy. This stage may involve advanced treatments such as heart transplantation or mechanical circulatory support. Heart failure can also be classified based on the ejection fraction, which is the percentage of blood pumped out of the heart with each contraction. There's heart failure with reduced ejection fraction, where the EF is below the normal range, typically less than 40%. There's heart failure with mid-range ejection fraction, where the EF is between 40 and 49%. And there's heart failure with preserved ejection fraction, where the EF is equal to or greater than 50%. These classifications provide a framework for understanding the progression and severity of heart failure in patients. They help guide treatment decisions. But remember, heart failure is a dynamic condition, and patients may move between stages or classes over time based on their response to treatment and changes in their health status. Regular follow-up assessments are crucial for adjusting management strategies accordingly. So there you have it, a comprehensive look at how heart failure is classified. It's a complex process, but one that's vital for managing and treating this life-altering condition.